This video illustrates some of the requirements for a disability-inclusive healthcare facility. It takes into consideration the peculiar needs of persons with disabilities using the concept of universal design. Cars with persons with disabilities in them should have designated stickers for easy identification. This enables security personnel to direct driver to appropriate parking space for persons with disabilities on board. The reserved parking space for persons with disabilities should be located close to the entrance of the building for ease of access. It should have a signage indicating that it is exclusively for persons with disabilities. Building entrances should be clearly visible and prominent and should be designed to meet the universal requirements, such as standard ramps and rails. Stairs should also be visible and could be color-coded for easy identification. Doors should open wide enough to accommodate 360-degree rotation of wheelchairs. In medical settings, effective communication between patients and healthcare professionals is essential. The absence of a common language or communication method between a medical professional and a patient creates a challenge. The communication gap may be between a medical professional and a deaf patient, or between the medical professional and a responsible person other than the patient, such as the deaf parents of a minor or the deaf adult caregiver of aging persons. A qualified sign language interpreter can bridge this gap, and this is the responsibility of the hospital or facility providing the medical service. This interpreter should be present at all situations in which the information exchange requires effective communication, such as taking medical history, explaining tests, procedures, diagnosis, planning treatments, providing discharge instructions, and scheduling follow-up care. This is to ensure that all services and programs are available and accessible equally to all persons. There is an absolute need for persons with disabilities to have full access to all medical diagnostic equipment, such as adjustable examination tables and chairs, weight scales, mammography equipment, X-ray machines, radiological equipment, and so on in the hospital. Toilet routes should be accessible and wide enough for easy navigation. The passageway should be well illuminated and should contain bold lettering and appropriate signage for direction. The toilet handle should be at reasonable height and accessible. The toilets should be wide enough for a 360-degree navigation and should have grab bars for transfer from a wheelchair onto the toilet seats. The flush control should be located on the open side of the water closet at an accessible level. The toilet should be well illuminated. The wash basin, hand dryer, soap, tissue, air freshener, and so on should be in place and accessible too. Facilities and services should be designed to accommodate the accessibility needs of women with disabilities to ensure that they are not denied access to health on the basis of disability. Everyone working in the healthcare system must be made aware and trained to address the rights of women with disabilities, especially in the context of access to health.